What started the Jumpstart Your Heart Foundation?
Jumpstart Heart Foundation was founded in 2008. And really what, I guess, started the whole process was when we lost the young athlete, Shannonville, at Glen Oaks High School. Following that, we kind of did research and we looked what was being done worldwide and what was being done here in the U.S. There is some data that showed where they were doing screening EKGs in Italy as well as other parts of Europe, where they actually decreased the incidence of death amongst young athletes. After review of all that and our desire to save, at least if we're happy if we save one child, we started our mission to add, in addition to doing EKGs, to do a screening echocardiogram. And the screening echocardiogram, we're able to detect the most common cause of death among young athletes, which is hypertrophic cardiomyopathy. There are a lot of people who will argue that it's maybe not cost effective to do these tests on every amateur athlete, but we kind of look at it a little different. And our goal is to, like I said once again, if we can help one child, we're happy with that.
What is a heart screening and what does it involve?
The heart screening is in addition to the current pre-athletic physical exam. And with that, we do an EKG. An EKG is a heart tracing where it looks at the conduction system of the heart, because some athletes will have rhythm disturbances that could potentially be life-threatening to them, as well as we can find other abnormalities that the athlete may not be aware of. In addition to that, we do the ultrasound test of the heart, which is called the echocardiogram. As noted earlier, the hypertrophic or extremely thick heart is the most common cause of deaths that we see in young athletes. And with this echocardiogram, we're able to detect that. And this is the test that's the test of choice to make the diagnosis, because we have had a few athletes that are close to me that have been affected by heart disease.
In 2011, how many student athletes have died in Louisiana because of undetected heart problems?
To my knowledge, I want to say 2 or 3, or maybe a little bit more. But to my knowledge, it's been 2 or 3. And I think with these tests, especially with the echocardiogram being a part of the screening, we'll be able to detect those type of problems before we end up with a premature death in an athlete.
Why do you believe these heart screenings should be mandatory in sports physicals for student athletes?
Well, once again, I'm of the belief you really cannot put a price on a kid's life. And I think that we ask a lot of them to be out on the field, on the court playing. And I think we ought to do the best we can to protect them as much as we can. And I think by doing these screening exams, there are going to be some kids that we're going to find that they necessarily should not be on the field. And once again, I'm of the philosophy that if we can help one child, then we've done our job.